Hello everyone, I'm Deepshikha from InnoHealth Conference 2024, and today for the InnoHealth Magazine podcast, we're going to be interviewing Dr. Sanjeev Kumar. Thank you for being here, sir. Thank you so much. For our listeners, would you just introduce and familiarize the listeners with yourself and who you are and what you do?
I'm a medical doctor by training. I did MBBS from AIMS in 1976. And I worked in the army for 5 years, came back to do my MD. I taught for about 4 years. Then I joined UNICEF in 1988. So till 1999 I was in India, then I went abroad. So I went to Geneva, South Africa. If we add up the countries I visited, it comes to 33.
Wow.
But we were feeling homesick, both me and my wife. And I decided to take early retirement 3 years before I was to retire, come back to India. My God, amazing things are happening in India in public health. I've never had a moment of, I felt that why I left such a good job in the UN. I was director of International Institute of Health Management Research. Then I was, there's a government institution called National Health System Resource Center. I was executive director there.
Wow. Well, so considering the large expanse and various arenas of healthcare that you have seen, in a brief amount of time that we have, if you could tell a little story of how you've seen the healthcare scenario evolve compared to how you saw it back home in India.
I left India in 99,
right,
and I came back in 2012. Things had changed. In those 12 years, you had new cadre of workers, accredited social health activists. You had a huge program, National Health Mission, with thousands and thousands of rupees being released by the central government to the state. And there's a lot more awareness about health now. And that has even got better after COVID. So people are looking at public health people more. Earlier they were looking more at clinicians. So things are good. And when you look at indicators in health, when I was born, average lifespan of an Indian was 32 years. Today it is 71 years. So कुछ तो अच्छा हुआ होगा. इतना lifespan अगर बड़ा है. And women for last few years are living longer than men. It was the other way around because there was discrimination. So hopefully this is because of the discrimination against women coming down.
Well, times are changing, and of course we're seeing healthcare making so many strides and all. So since we're here today, and you must have seen the involvement of tech as well, and integration of AI into everything as well, as is the theme that we have today at the conference. So coming from an era where everything used to be so paper oriented, you put in your elbow grease and everything else, and now you're seeing everything being very TikTok and very on your desk, and you have the EMRs and everything else. So how have you paced yourself, and how have you made yourself unlearn and learn all of the things in this journey?
I feel excited whenever I talk about technology. And when I was heading NHSRC, there was a division looking after technology. So I was aware of what is happening in the country. This is technology which is going to revolutionize healthcare. And those of us who are medical doctors or healthcare professionals, we need to be aware what is changing. To change, artificial intelligence didn't come for medicine, but now it is coming to medicine, and a lot of things are going to change for the better of the patient.
Right.
So I am very excited. But I look at artificial intelligence or technology not for patient care. Because if you look at only patient care, in last about 10 years, number of diabetes has doubled. So you will have number of cases increasing because you are not preventing.
Right.
So you have to look at address those who are healthy, take care of them. There are many apps available which can look at what they are eating and how much exercise they are doing, so that they never fall sick. Then you have people with risk factors. Parents have diabetes or something. These people don't have diabetes today, but they are more likely to. So they have to be more rigorous in looking at healthy lifestyle. Then you have people who have, for example, diabetes. Many of them don't know they have diabetes. They have never been tested. In India, the last National Family Health Survey, I can say broadly, out of the diabetes cases, no, this was for hypertension, out of the hypertension cases, half of the hypertension cases are not known. Out of the half who are known, another half of them are not taking treatment properly and their blood pressure is not controlled. So it's only 25% we are reaching out. We need to look at how can we improve compliance and how can we reach out to those who have never come to blood testing. Maybe we can have people going around in the community with simple, like you look at plants, you touch it and you look at chlorophyll, how much is there. So similarly, you can touch somebody's finger, you know how much hemoglobin is there, or how much blood pressure the person has. So I'm sure that technology will come very soon. So we need to look at those who are healthy. Otherwise, you have more and more cases coming. Hospital will get flooded, overwhelmed with the cases. Community will have a lot of stress. And we just talked about life expectancy increasing. But number of years which are healthy is not as much. It is not increasing. Because those with diabetes, hypertension, cardiac problems, they are living much longer because they have medications available. Earlier, their lifespan was very short. So we have to be more careful as things are changing now. About 11 crore people are above 60. They have many of these problems. We need to take care of them. So things are changing, but technology is exciting. I think that is the answer to our health problem.
Well, since we've already, discussed such pictures, scenarios that you've put in front of us, I can actually see all of those textbook terms and the textbook incidents and prevalences, all of those coming to life in front of me. I see examples coming in front of me, and I hope the listeners also got those visuals of where we need to put our foot in and, put the technology in and take aid of health experts like you, basically, in order to make longer strides in healthcare. Thank you so much, Dr. Sanjeev Kumar, and it was so nice to have you here. It was a very warm session. Thank you so much.